Hello and welcome to the Health for Mzansi podcast, where we celebrate the remarkable journeys of those who dedicate their lives to healing others. I'm your host, Dawn Umdu, and today we have an inspiring story of perseverance, dedication, and compassion. Lydia Ntezo, a cardiac scrub nurse at the Life Vincent Pallotti Hospital in Cape Town, came from humble beginnings in Mtati village in the Eastern Cape. Today, she's a beacon of hope in the field of cardiac surgery. Here's her story. Lydia, welcome to the Health for Mzansi podcast. It is such a pleasure to have you join me. I'm so interested to know more about you, the work that you do in the healthcare sector. Welcome.
Hey, Dawn. I'm so glad to help you out, to tell me about my story. My name is Lydia Ntezo. I am just an ordinary girl who grew up in the dusty village of Mtati in a small town of PD in Eastern Cape. And I am a last born at home. We are 5 children from my mom and dad. During my childhood, I was very active, playing with other children and mingling. I was involved in participating in sport in primary school and in secondary school as well. I was just an easy person to deal with other people. I am married now with 2 kids. And I'm working in one of the private hospitals in Highlands. That's me. I am a nurse. I am a cardiac scrub sister, by the way.
Absolutely amazing. Yeah. I was just commenting to say that everyone's work is so different. I spoke to a virologist this week, and I'm talking to you as a cardiac surgery scrub nurse. And I think you all have such an amazing role to play within the sector. And I'm so happy to celebrate you and talk more about the work that you're doing day to day. You just mentioned, as part of your sharing a bit about yourself, a bit about your growing up years and your family, that you were always an easygoing, relatable person. Is this what motivated you to pursue a career in nursing initially?
Yes, because I'm an easy person. Also, the experience that I received. First of all, I must say, as a child, I was always have a frequent going to hospital due to the healthy condition. And I was satisfied by the care and the treatment that I received, and inspired me to consider a career in nursing. I also realized to become a nurse, it will give me a unique opportunity to provide the care to others.
That's really cool. So you kind of looked at nurses taking care of you, doctors taking care of you, and you were like, this is something that I would like to do in my future, to take care of other people.
That's what I do. Yeah.
That is so inspiring. Can you describe, the most rewarding experiences that you've had as a nurse? And also maybe you can touch on some of the challenges that you've had.
My rewarding experience is to see the very sick patient who come to cardiac surgery. And then after procedure, after whatever we did, and then see that patient, like to pay the visit to the patient, to see that patient is much, much better than he or she was before admitted. Those are my rewarding things, that the experience that they touch me, because, some patients, they just came in, they are very sick and they are so scared, they don't know you, and then they are relying on you. They give that hope, because some of the patients, sometimes before the procedure, they call us and then tell us they are reliable on us. So it gives me that rewarding experience. Then there's some challenges as well in the cardiac operation. The first thing is the long hours, because cardiacs, you start from 6 o'clock. Sometimes we expect it to be finished at, let's say, 12 o'clock. And then sometimes we end up to finish at 1700 hours, which is almost at 12 hours. So it's our challenges. But the most of the challenges, sometimes because of the complexity and the complication during the procedure, it extends our hours. And another challenge we always get it sometimes, you cannot go far. If you're doing the procedure today, you cannot go far. Let's say I did my cardiac today. I must go to Eastern Cape to visit. No, I must be around. So in case of emergency, also the patient can bleed during the night when patient is in ICU. So I must be able to come back and to fix that patient or to help the doctor to seal that bleeder. So it's the challenges that we also come across with.
And what inspired you to specialize in cardiac surgery as a scrub nurse? Maybe you can take us through where you studied. Were there any additional qualifications you had to do to specialize in this area as part of your learning? And also, if you can take us through your timeline. After school, what did you go and study? Where did you study? If you can share a bit about that timeline. Thanks.
My story is long done. I must say, I just came here in Cape Town, I think 2001, around 27th of July, I remember. I already passed my matric at that time. So I didn't even know what I want to do. And I just come across, you know what, because I said I want to do nursing, let me go to one of the university in Cape Town to apply. Because I didn't know Cape Town very well by that time. So I went to one of the universities. You know, by the gate, there's some securities. When I asked the information, they said, no, it's full. You can't come in here. I went home and I was so sad, you know. I said, you know what? These people won't give up. You know, there was one of my friends because we grew up together. And I asked, man, I'm interested in nursing. What must I do? They say, you know, don't you want to go to do the home base? So I started to do like a home base care. I said, no, man, this is not for me. I can't look after the elderly patient. I must do something else. I can go forward. And then go to do the ENA, which is the auxiliary nurse. From there, I pass, I do the EN to become a staff nurse. And then as soon as I finished my staff nurse, I went to work in one of the private hospitals in Panorama. Then there, I was working in the wards, helping patients, give medication as my scope of practice. Then because I'm that person, I can't start in one place. So I have to do something more, something that is interesting. So I applied to do the sisters course. And I applied in the UNISA, and then I qualified there to become a sister 2010. From there, I transferred from that Panorama Hospital to another hospital, but in the same company. So from there, I work in the orthopedic ward, I work in general ward. During my practical, I just felt like the problem that we just come across in the ward. Sometimes, you know, the patients and the family, you nurse the patient and also if you nurse the family, all those kind of things. I fell in love in theater because in the ward that I was working, we didn't understand sometimes the patient, they complain about the small operation that they went. So when I decide to go to theater, I'll say, you know what? Let me go and see what makes these patients complain a lot so that I be able to nurse this patient. I went to theater. They just asked me to start to do anesthesia, which is helping the doctor to make the patient to sleep. I did that and I enjoy it. And then I have to leave that hospital because I'm that person, as I said before, I want to do something more. So I decided to do the scrubbing, which is to assist the surgeon during the procedure to see better what's going on the table. So from there, I have to go apply to University of Stellenbosch to do specific the theater. So I went to University of Stellenbosch. I did qualify as a theater sister course there, and then I came back. And during my work experience, through all the disciplines, orthopedics, neuro, I decided, you know what, I want to do something bigger. You know, to work with heart is such a big thing. Not everyone, especially here in Western Cape, a black or young woman to do cardiacs, you know, those big, short people who can do, not everybody can do it. I was eager to learn. And then one of my sisters said, you know what, because you are interested and you are qualified, let me take you through. And then they take me. And then I think I started, like I was observing here how they do things because I said, I want to do this thing. So I have to learn hard. I have to take some books. I have to Google to do the research, what's going on, because you have to know the anatomy of the heart before you start to do the cardiacs. So I strive, I worked very hard to learn. And then I said, I think after 3 days, I said, you know what, sister, let me do this thing. You're going to stand in front next to me so you can help me. And then introduce me to the doctors, and the doctors know. They were so happy to see one of the young ones can do the cardiacs, because most of the time, all the old nurses, they want to do it. So that was my story.
I can hear the passion in your voice. I can hear the drive that you had to get started. pushing yourself in the specific sector within healthcare in South Africa. And like you said, celebrating you as a Black woman in this specific industry, and specifically in cardiac surgery as a scrub nurse, is what I am here to do today. So thank you so much for sharing that story. It is really amazing. You spoke briefly about the long hours. Sometimes you go into the surgery, you expect it to last a certain time, and then you have to stand for even longer, and you have to do the operation for even longer hours. What is a typical day in the operating room during a cardiac surgery procedure? You can just take us through that.
In cardiac, the thing is what we're doing here, we've got a group with our surgeon. They brief us, tell us in advance on this particular day, what are we going to do? And they share the patient that we're going to do. And then we have to go in ICU and then go and see the patient and go talk to the patient before the procedure, to introduce yourself before the procedure, and then go back to theater. And then in theater, there are some preparation that we're supposed to do before so that we don't have any rush. In our theater, everything is inside theater. We make sure that all the equipment, the emergency things that we are going to use it are inside the theater. And all of us, we are already trained or well trained about anything that will happen during the procedure, because cardiac is not just cardiac, it's something else. Cardiac is something else. Sometimes there are lots of complications during the procedure, but we manage because we've got everything that we might need inside theater. So the typical day, there was a day that I will never forget, and it's break me through. That day, it was one of our young patients at the age of 41 come for heart surgery. It was the day before they eat, and that patient was a Muslim. Before they get the anesthesia, they call us all. And he just gave us a touching word and saying to us, he wants to thank us all in advance because the work that we do, it's got the faith on us. And then during the procedure, we did everything very well. When we're about to transfer the patient from our theater bed to the ICU bed, and one of my colleagues was about to phone the family to tell that we're going out, then something happened. Everything just crashed down. We resuscitated that patient, and then boom, patient can make it. That day, I will never, ever forget it. It breaks my heart, but I have to be strong for the family. We have to calm the family. We have to tell the family what's happening. But the patient was very, very, very sick. But we try by all means to do everything right, but it was not in our hands.
It is difficult. I mean, I'm hearing your pain still to this day, just talking about what that experience was for you. The one aspect of healthcare that is really difficult for you as a nurse, but also for the doctors, having to talk to the patients, because there's a family waiting. There's loved ones waiting for this patient to recover and get better. I commend you for that, for the strength that you have to be able to do the work that you do every day. You actually in part answered my next question, and I think you also have mentioned it before, some of the challenging aspects of cardiac surgeries. Now, how do you handle the high-pressured environment of the operating room, especially when it comes to those critical moments in cardiac surgeries? I think you just alluded to one situation, but, you have to keep a level head. You can't lose your mind in that situation. Is this something that you get trained to do, this high-pressured environment? And if you have any advice to someone who's aspiring to be in your position, what would that advice be?
I think I did mention earlier on when I done, is that in cardiac theater, everything is prepared. We know, and each one of us, they know their role to play in case of emergency. That's what makes us strong and lift our heads high, because we know what we're doing and we are well trained. There are some also rep who normally comes to our theater. If anything that is new that we're going to use, for example, today we were doing the multiple 2 double valve, which is a mitral valve and aortic valve replacement. So we use a new valve replacement. There was a rep, and before that, we contact that rep, come to theater to teach us how to use this, how to handle these type of things that we never used it before. So each and everything that we're going to use is inside theater. So in case of the emergency, so we know if we're going to use a balloon, we know where it's a balloon, what we must do. It's like we are working as multidisciplinary team in theater because there are lots of people that are involved. Although we are not messy, like too much people, but we know that as a team, each and everyone know their role to play.
I think the preparation is key when it comes to the type of work you do. And you've just, reiterated that again. Now back to you in terms of your future, your dreams, where do you see yourself moving to in the next 5 to 10 years on a more personal level? You mentioned your 2 kids. What do you see yourself doing? Your passion for the sector is clear. Would you like to continue? Tell us more about your plans.
I don't have much plans. Only thing that I want to do, I want to be a cardiac teacher. I already have 2 students for now who come from different hospitals, especially the black ones. As I said before, they are interested. So I'm teaching them. Yesterday, I had 1 student from one of the private sector, and then I've got another one. They also black one. He came to because they said, how can you do this thing? Because not everyone can do this. I said, you can. If you want to do, you can. There's nothing wrong to do the cardiac. And then I will introduce to the doctors. There are some workshops. So I want to be a teacher and help the more nurses who want to do the cardiac theater.
I think the mentorship element is really important for anyone's learning and growth within any sector. Great that you're already doing that and that's something that you're striving towards. Just a last and final message that you would like to maybe share to your colleagues, the doctors that you work with, fellow nurses, as we wrap up this discussion today. Just a message from your side to kind of keep on keeping on in the work that you guys are doing. Thanks.
Don't give up. If you want to do something, strive for that thing. Don't lose hope. Just focus and be patient. Then one day you'll be what you want to be.
I love it. You are so humble about the work that you're doing.
I love my job. I love it so much. And the doctors that I work with, they understand me. We can shout during the procedure because sometimes it's a stress, but after that, we laugh and share jokes. So yeah, I love my doctor so much.
Thank you so much for sharing your journey with us. A key takeaway for me is, despite the long hours and emotional stress, Nurse Lydia Ntezo finds her greatest reward in seeing very sick patients recover after surgery. Her story is really a testament to the profound difference dedicated healthcare workers can make. Until next time, greetings from me, Dawn Numdu, our technical producer Megan van der Vent, and the rest of the team Health from Zanzi. Stay inspired.